Now let's talk about tuberculosis or TB. Tuberculosis is actually an infectious disease. It's caused by a specific microorganism, and when the disease is active, it leads to what we call the nodular lesions at the lungs.
Ladies and gentlemen, the germ you love to hate, Mycobacterium tuberculosis.
Yeah, so that's Mycobacterium tuberculosis. It is a gram-negative bacteria. It's acid fast bacillus, and this classification comes from the lab when we send it to microbiology lab, and then those are the special dyes that we use. The gram positive and negative, and the acid fast, and depends on the reaction of the microorganism will classify them. So it's good to know that this is the classification of this microorganism. Now for the tuberculosis, as far as infection, the pathophysiology. So the transmission of these diseases comes through droplets. So there will be a patient who is infectious, has that TB, active TB. When this patient sneezes, for example, it will usually the average about 3,000 droplets with every sneeze, and each droplet has between 3 to 10 microbacterium. So when a patient inhales that or another person inhales it, so microbacteria, just like any other microorganism, will invade and will it goes all the way to the alveoli. In the alveoli, it will be recognized by myocytes, and then it will be engulfed. Now, when it's engulfed, doesn't mean that it dies. It means that it will be circled and become inactive, and that's what we call latent TB. Now, it will continue to be like this until things change, either increase of exposure or decrease of immunity, and that's when the TB will be reactivate itself. Now that the immunity is low, one of the major reasons, like in patient with HIV, and now we get an active TB, and then this person now become infectious and so on. Now, so who's at risk? Basically, as you see from the pathophysiology, for the first step of this disease or in the pathophysiology is exposure to TB. So basically, the major etiology is an exposure to TB, and this exposure increases in specific places because of the sanity, because of the crowdedness and so on. So you will see it, for example, among homeless persons, inner cities, prisons, long-term facilities, and of course, the longer the exposure for the healthcare provider, also nurses and doctors and everybody who deals with patients will be also at risk. The risk for reactivation will be in patients their immunity is compromised, as we talked about them before. Now, the degree of risk will increase as considering this etiology. So, for example, the longer the exposure, the more concentrated the droplets, the closer to the person in contact, and so on. So, all that can increase the risk for this patient or for this person who's exposed. People with lower immunity also will have higher risk to acquire this disease. So again, just to clarify, so microbacterium invade will be found by the myocytes, will be encircled, become inactive, and they're waiting. So this is latent TB that's waiting for immunity to change. The latent TB is not infectious. Patient doesn't need isolation, and usually they do not show symptoms of active TB. However, treatment is recommended so it does not become active. HIV, for example, immunity is low. These guys will be activated now. There's no longer enough immunity to engulf them, and then the patient will show active symptoms of TB. Now, this active TB is infectious, and the treatment is required now to treat the infection, not only to prevent the reactivation. Now, as far as the clinical manifestations, again, microbacterium is available in droplets, and so this is an there's an immune reaction to it. As you see in this picture, they are engulfed, so they become inactive. So patient after their immunity goes down, now the infection become active again. As an infection, immune reaction, metabolism is high, and as a result, it will be temperature. This temperature goes higher at night, and that's what leads to night sweats during the night. Also, these patients become anorexic and have low appetite because of the active process. So there's an unexplained weight loss, unintentional weight loss. That's another symptoms of active TB. Now, as you know, every year when you are screened for TB, you get questions about these specific symptoms because these are the classical symptoms of TB. Of course, as a result of active disease, less energies, and now less nutrition, patient will show symptoms of fatigue. And then the other thing is because an active TB patient is coughing and then will have a productive cough. And that's sputum what we will send to identify the microorganism to see if it's a TB, an active TB or not. So the way we confirm the diagnosis, the first thing we do is the PPD test, one-tox test basically. And simply this is a PPD, which is a protein that we inject 0.1 milliliter intradermally, and then we read it 48 to 78 hours later, and we're looking for induration. Not only redness, we're looking for induration, elevation in the skin. And that's going to indicate that's positive TB. Does not necessarily means it's an active TB. It's just positive. Now, it's important to know that this positive result depends on the patients. So if you have a healthy patient with no risk, this induration has to be above 15 millimeters to say that this is a positive TB. If this patient has high risk, like is an IV drug abuser or live in a prison or in a homeless, so they have high risk, induration that's more than 10 millimeters will be considered positive. If the patient is immunocompromised, like in patient with AIDS or HIV, any induration that's more than 5 millimeters will consider positive. So it's not standardized. It depends on the condition of this patient. Okay, now the other test is the chest X-ray. As you see in this chest X-ray, we talked about the nodules that the patient may develop in case of active TB, and that can be seen on the chest X-ray. And we talked about the idea of exposure and how air is different and bone is different, and the idea of absorption of X-ray that depends on the tissue that is there. Now, the other test is the other important test is a sputum culture. So basically, we talked about how you should collect a sputum specimen from this patient, and we send it. We talk about 3 different types. Now, this is a quick test that we do, and we do usually 3 consecutive samples, and the 3 must be negative for this test, the acid-fast bacillus, in order to say that the patient doesn't have an active TB, or in order to say the patient is not infectious anymore and they doesn't need to be in isolation. Let's see how this test is done.
Now I'm going to show you how to do an acid-fast stain. I have already prepared sputum slides for you, and they already are heat fixed. So ordinarily you would make a smear and heat fix it, and then start your staining. The staining procedure is very simple. We start off with carbofucsin. Just cover the smear with however many drops it takes to cover that smear. Leave it on there for 3 minutes. After 3 minutes, you want to rinse the carbofucsin off the slide and shake off the excess. Then you want to use acid alcohol for a destaining step, and you just add a drop by drop until the pink or the purple stops running from the smear. And it looks like it's going to take 6 or 7 drops maybe in this case. Then you want to rinse the slide immediately again. Shake off the excess water. And the last step will be methylene blue. And you're going to cover the smear with the methylene blue and leave it on for 1 minute. After 1 minute, rinse off the methylene blue from the slide and shake off the excess water, and then blot it gently with a Kim wipe until it's dry. And then you're going to look at the slide under the microscope using low power and then high dry, and then you must use oil immersion to see the small acid-fast bacilli, which will appear reddish, and the non-acid-fast bacilli will be blue, and all of the background material will be blue also.
Okay, so this is how it is identified. Now, so what you just saw, this is what we call the staining. It's not culture. This is staining. We identify it by its reaction to the chemicals that what we do, and this is basically to identify if it's a acid-based bacillus, which TB is one of them. Now we still will do the culture, and the culture sometimes take up to 8 weeks in this particular microorganism, but it can come before. So a few things important about the sputum culture. Now we do that again. It's a quick identification. We do 3 consecutive sputum that we collect on different days. 3 days, day 1, 2, 3, and then we send it for smear, for staining, and for culture. And this is important. This is the standards to say if the patient needs to be in isolation or not. Again, as far as the instruction to obtain the sputum is the same idea as we talked about the sputum for pneumonia. And so now let's talk about the management for this patient. Again, we have an active TB, so there's an infection that's need to be treated. Meanwhile, we want to focus on 2 things: the symptom management as well as the isolation. Big time here, infection control for this disease. So we have an active TB. We will need to give TB drugs. Now we're going to look at the differences between TB drug for an latent TB versus an active TB. And so usually we give at least 4 medications, 3 to 4 medications at the same time for a long time, varies between 6 months to 9 months. And of course what we're looking for is that the disease become inactive as evidenced by clear chest x-ray and no symptoms of active TB. This patient needs to rest and need nutrition because we need this energy to fight the infection. And as far as the drugs, again, if the patient has active TB, we usually use between 3 to 4 drugs between 6 to 9 months to eradicate this infection. These are the 4 common medications that we use for active TB. For latent TB, we usually just use the INH for 6 months, or at least 4 to 6 months, and that's enough just to prevent the reactivation of the medication, or of the TB. Sorry. Now the TB, they share this TB medication. They share common problems or consideration to keep in mind. They cause or a patient who receives them is high risk for what we call non-viral hepatitis. It's inflammation of the liver that's not caused by virus but basically as a reaction to this medication. As you see, the medication regimen goes between 6 months to 9 months. So adherence is a problem. It's something that we want to find different ways to encourage the patient to adhere to this medication to finish it. Now, as nursing management, one of the major things is the isolation. Again, the patient should be in airborne with negative pressure until patient become not infectious, which means at least 3 negative AFib smears, or patient improved, or chest X-ray is clear. When you deal with this patient, you must wear a mask like N95. And this is what we call high efficiency particulate air, and that's to protect yourself. Regular surgical mask does not help. That's not sufficient for a healthcare provider who's taking care of a TB patient. As far as our patients, now we want to teach the patient that to use tissues, paper tissues every time they cough or sneeze, and they put that in a paper bag, and then that paper bag should be burned or should be trashed or flushed in the toilet. That's very important. If the patient needs to go out, let's say you want to take your patient to X-ray or for whatever reason, they have to be in a standard isolation mask, just a regular mask. But if you are the nurse, the healthcare provider, or any kind of visitors, should wear that N95. Now, if it's a family member, there's always a discussion about the family members. Can the patient go home? Yes, they can, because if he lives with family in the house and it has to be, they're already exposed. Now, they should be tested. They should be tested for TB, either latent or active, and should be treated accordingly. However, isolation is not required at home because everybody got exposed already. This is the N95 that every nurse and every healthcare provider, usually in a hospital, is tested on its fitness before you can, can even start with your work. Okay.